Good day, everybody. How are you? Are you fine? Welcome to my English lesson. Let's introduce myself. I am an English teacher at the chair of practical course of English language. My name is Ражаматова Жазгул. Now, dear students, I want to start lesson with proverb. A new language is a new life. I think you like English, because English is very necessary language nowadays. First, at the lesson, we will speak English, listen, create, and learn new material. Look at their picture and try to guess the new theme which we are going to discuss. Here are the symptoms of this theme. Of course, you're right, we are going to talk about tuberculosis. What do you know about tuberculosis? Tuberculosis is an infection disease. It attacks your lungs. It can also spread to other parts of your body. Tuberculosis is caused by bacteria that spread through the air, a type of bacteria called mycobacterium. You can get TB only if you come into contact with people who has it. And I think you know, the symptoms of tuberculosis. They are coughing, cough with blood, chest pain, weight loss, tiredness, fever, night sweat, chills, not feeling hungry. Of course, and we have the treatment of tuberculosis. The patient who has this mycobacterium, they must to drink anti-tuberculosis drugs. Then probiotics, immunostimulants, immunomodulators, antibacterial drugs, vitamins, special dietary. TB transmission. Most of people affected by tuberculosis do not have symptoms and the disease is not active. This is called latent tuberculosis. However, about 10% of latent infections progress to active disease, which if left untreated, kills about half of those affected. Diagnosis of active TB is based on chest X-rays as well as microscopic examination and culture of body fluids. And dear students, these are prevention of tuberculosis. The first, healthy diet. Wash your hands after sneezing or coughing. Stay away from coughing people. Get rid of smoking. Wet house cleaning and ventilation. Dear students, our time is over. See you later. I wish you good health. Thank you for your attention.